all sorts of charts in front of me. I sit there and say, why are you showing me this? I don't know what you want me to do with it. And I think the same thing happens with patients. We can't have process measures for everything in medicine. I think we know that. There's certain things that are evidence-based, sure, we can get process measures, but over 90% of the care we still deliver today is without process measures, or without evidence behind it. So how do you deal with that? Not everything's covered by a guideline. And of course, we want organizations to cover every aspect of their health care, not just the ones they're graded on. Because what they're graded on is a small portion of the care that they provide. And last but not least, if you start grading people on measures, or what our government is doing is linking reimbursement to these measures, would you rather spend $1 million trying to get your score from 98% to 100%? Is it really worth it when you could take that $1 million and spend it on something else where you could improve care in a bigger way? So there's a big debate going on in the US right now as to what should be the cap, what should be that upper limit for which we want people to get as well. And to give you a case example of how you can't do it by the numbers, I'll just give you a hypothetical case example here. You can imagine you have a healthy woman who gets sick. She doesn't feel well. So she tries to get to see her primary care doctor that day, but she can't get in. So she goes to a local emergency room and gets seen by a resident and an attending. They do a really good job of taking care of her. And the resident is so thorough, even though most of us wouldn't order blood cultures, the resident orders blood cultures this time. Okay? She goes home and she's told that you might just have a viral illness, and she goes home. She comes back to the ED 2 days later, the emergency room 2 days later, and at this time when she comes back, she's actually very septic. She's so sick she was septic, she had to get intubated. It turns out when somebody was looking through her medical record, they realized that the blood cultures that were drawn on the first day had turned positive, but no one had followed up with her and started her on antibiotics. So she had a 2-day delay in getting her antibiotics started. Okay? She makes a full recovery, completely full recovery, and the family doesn't suspect any problem whatsoever. Okay? In fact, the family comes and thanks you for being such a great doctor for taking care of her. Okay? So a couple questions for you guys on this. So you can see that the measures that we have, you can see that the measures I just talked about, they're not going to capture this, how many times this gets missed. None of the publicly reported measures are going to capture it. Can you guys see this happening in your clinic or your hospital? Show of hands, who can see this happening here? How many of you think she should be told about this mistake? She made a full recovery, and she thinks this hospital is the best hospital in the country. How many of you think she should be told that the cultures were missed? Show of hands, who thinks she should be told? No? She should be told? Show of hands. How many of you think she doesn't need to be told? You don't think so? Okay. I'll ask you later why, okay? So, next slide. So what I want to do is talk a little bit around culture around healthcare, because one of the things that we talk about with regard to transparency is that this mistake, if people don't talk about it, it may never get, nobody may know, not enough people will know that it happens, and the system may never improve to fix it. Because if you don't make it everybody's problem, it often doesn't get fixed. Right? And culture is so important when it comes to talking about it. So can we go to the next slide? So what I want to talk about is disclosing. I want to talk a little bit about how do we disclose, and this is another concept of transparency, right? Being open with your patients. We argue in our country, we argue that when anything goes wrong with a patient, you should apologize for the event, saying, I'm sorry that this happened to you. That you should promise to investigate, say, we're going to look into it, we're going to tell you what happened and what went wrong. If it's our fault, we're going to admit it. We're going to admit it's our fault and we're going to take responsibility for it. And in fact, once we admit that it's our fault, we're going to tell you what steps we're going to take to improve it, and we're going to take those steps to improve. Now, those of us that advocate, and then sometimes also, if it's our fault, we'll also offer you compensation. Now, those of us that advocate for being open with patients, the two things that I put in bold, that's what transparency is all about. You admit your fault when it's yours, you let them know it's your fault, and you tell them what you're going to do to fix it. Now, I argue the real power here is that if you're going to do those, the other 3 steps, they come with it. Because there's no way you're going to apologize to a patient, say it's my fault, and not fix it. Because if you don't, you're going to look bad. So this is one of the big benefits of disclosure of errors, what we argue. Now the problem with disclosure, of course, next slide, is that people worry about it, right? I think from everybody agrees ethically, we should be telling patients about all our mistakes. People also agree that when we talk about transparency, again, it's going to build more trust. Everybody wants their doctor to be honest with them, and likewise it can help with our cultural things. But of course, there's a big disagreement here with regard to what happens when you tell a patient. Some people argue that if you tell people that you made a mistake, they're going to take you to court and they're going to just clean you out. Other people say that's not true. That's not what patients want. They just want you to be sincere and honest with them. And if you are, they won't sue you. What do you guys think? Any comments? I'll keep going otherwise. So big debate on this, okay? And Sammy was telling me, I guess, that you have a problem with more malpractice suits in Brazil nowadays. Is that true? Do you guys worry about being sued?
Yeah.
Would you worry if you were the emergency room doctor in this case that you would get sued if you told the patient? You would worry. Even though she made a full recovery, you would still worry, huh? Next slide. And it turns out if you talk to patients, you ask them, what do they want? If you survey them, they say, look, you want to know if a mistake happens in your healthcare. They said 90% of the time, they said, we want to know about it. They actually, 81% of the time, they think it's reasonable to expect an error. And then but they want to know about it right away. 98% of the time, they said, we want you to tell us right away. We don't want you to wait. We want to know about it right away. But of course, the big problem is right down here with these two slides here. 70% of the time, they want some financial compensation. And of course, that's the part that drives doctors crazy because we say, well, if it's a systems error, why do they want money from me? Right? So there should be a better way to do this. And of course, they want some type of discipline from the doctor 40% of the time. And that's an even bigger problem for us because we often have insurance, so we don't worry about the money as much, but the discipline is a real problem because it feels like it weighs on our conscience and our record. Nobody wants our reputation to be hurt. Next slide. The good news is that there's some data starting to come out now. So this is a study we did at the University of Michigan. In 2001, they had a new risk manager started there. And he started what they call a disclosure, apology, and offer program, or sometimes people call them communication and resolution programs. So if a patient is hurt at the university, they do exactly as I outlined. They go in and say, we're really sorry you got hurt. We're going to investigate. If it's our fault, we'll tell you and we'll pay you for it. The university started doing this in 2001. Over the next 2 years, they tied it in with all of their safety efforts. And then 7 years later, we looked at what happened to their liability outcomes. And look what happened to their malpractice claims, or their claims of the patients asked for money. It dropped by 36%. So here you have a university admitting its fault, taking system-level responsibility, offering patients money, and the amount of claims they had actually went down. So here they were being transparent, and everybody thought their liability experience would go the wrong direction. It actually got better for them. And the story gets even better if you look at the next slide. The amount of money they were paying their lawyers, that dropped by 60%. So they were actually paying their lawyers less money. And the amount of money they were paying their patients actually dropped by 60%, because it turns out they were able to pay patients earlier with smaller awards that they didn't need to pay bigger awards because the patients were happy with the smaller amounts that they were getting. So here, by doing the right thing, they actually found that they could have less claims, pay less to the lawyers, and still make their patients happy by paying less. Next slide. And in fact, this concept has caught so much attention in the US now that there are a lot of coalitions. I'm a member of one here in Massachusetts, where we've all come together and we're helping hospitals implement programs like this. Because it turns out it's not as easy as just saying, go tell the patient you made a mistake. You need a whole system in place to identify the mistake. You need a support system in place to help the doctor do this the right way. You need a system in place to investigate what's going to go on. You need experts to help the doctors talk with the patients, because you can't just leave the doctors alone because it's hard for them to do it. We're not trained to do those types of things. And then you also need a system in place to make sure the patient gets paid properly. So we're trying to help people do this, and this is the direction in which we're moving here. That said, I think if you ask most people in the US, do we disclose enough? People will still say we have a long ways to go. But it's becoming part of the normal culture here to be much more open in this regard. Now I say this, but here's the challenge we also meet here when it comes to being transparent with our patients and getting our providers to talk about mistakes. So this is the AHRQ Safety Culture Survey. Our government actually has a survey that all the hospitals can administer to their staff, asking their staff, how do they feel if they talk about a mistake? And you can see in the US here when it goes, if you mention an error that happens in your hospital, how good is the hospital at communicating about it and feeding back to you what they did in response? You can see that only over 7 years, that number went from 62 to 67%. It got better, but still not in a good place. Look at the bottom row here. If you ask people, if you admit you made a mistake, do you feel your hospital will not punish you? Only 44% of the time did healthcare employees say that they didn't think they would get punished. The vast majority of employees in healthcare still think they'll get punished if they talk about their mistake. This is one of the biggest barriers we have to transparency and to disclosure of errors. Because if people worry they're going to get punished, they're not going to talk about it. They're just not going to do it. So what are we trying to do to fix this? Well, we're trying to find the right level of accountability. Because the more, you obviously don't want a very punitive culture, because the more you punish people, you're not going to get the safety culture you want. But everyone also thinks if you go completely blame-free, that's not good either, because people need to feel like they're going to be held accountable. If they purposely do things or they get very reckless, you still need to hold these people accountable for their behaviors, because people make choices. So we've been trying to, instead of talking about a no-blame culture, people now started talking a lot more about a just culture to support transparency. And what do I mean by that? What I mean is you don't judge people by the outcome. You judge them by their behaviors. Like, how did they act? What did they do? And to give you an example, can we go to the next slide? Next slide. Next slide. Perfect. So we talk about human error. I think everyone's talked about this. So I've never seen this happen, but apparently it happens a lot. You can see the car drove away with the fuel pump in it. Has anyone seen this happen? No. I still don't understand how it can happen, but as we all know, people find a way to make mistakes all the time. What did the gas companies do about this? The oil companies do about this? They realize that people do this all the time. Rather than putting up signs and reminding people or punishing people or suing people, what do? They just redesign those pumps. So if you drive away with the pump in, it automatically just breaks off from the actual pump machinery so that there's no fire and there's no major damage. So this is an example of where people are going to make human errors. You design the system to make it better for them, right? When they're trying their best, we're all going to make a slip. So in these kinds of situations, you redesign the system and you comfort your employees. You don't punish them. You tell them, look, we know that anybody can do this, and because we think anybody can do it, we're going to change the system. That's one level. Next level is what we talk about at-risk behavior. Does everyone remember Steve Irwin, the crocodile guy from Australia? So what is he doing here? He has his baby in his hand. I don't know if you can make it out. His baby Bindi is in his hand, and he's feeding a crocodile. Now, I don't know if this made big news over here, but it made big news in the US when he did this. Everybody was upset with him. They're saying, how can you do this? But do you really think he thought he was being unsafe? I don't think he thought he was taking any sort of risk whatsoever. Because the guy, when he was 7 years old, was jumping on crocodiles and wrestling with them, and he's been living his whole life around crocodiles, and he thought it was perfectly safe. So we call this drift. You know, they talk about the normal's drift, in the sense that his behavior, he didn't think he was being dangerous. He didn't consciously disregard any rules. He thought he was mistaken, but he thought he was being just safe. So in situations like this, we're trying to let our employees know that we won't punish them either. What we will do is we'll coach them saying, you know, you probably didn't want to do this. It probably wasn't a very good idea. Don't do it again. And then last, does everyone know who that guy's in the bottom corner there? Right? So it's Michael Jackson, and that was his doctor. Now his doctor gave him propofol. I imagine you guys use propofol here, but he used it in an outpatient setting. Now I think every doctor knows that you should not be using propofol as an ambulatory drug. And everyone knew that he probably did too. So in cases like this, where you make a choice to disregard the rules, you should be held accountable for your behavior. And in fact, he was, right? Because